Okay, hey everyone, welcome to Region 7 Presents Hospital Librarians Going Virtual. My name is Margot Malachowski, and I'm an Education and Outreach Coordinator for the network of the National Library of Medicine in Region 7. We are recording today's discussion on January 22, 2026. So before we begin, we have closed captions available. You just click on the CC button at the bottom of your screen to start the captions for yourself. We ask that everyone keep your microphones muted to cut down on any background noise. Thank you. But we do welcome your questions and comments in the chat. My colleague Benny Finch is here with me today, and Benny will be keeping an eye on the chat. So please make sure you're sending to everyone so that both Benny and I can see your questions. This discussion, again, is being recorded. We will send a link to the recording to all registrants, maybe tomorrow if I get it together or early next week. And lastly, this discussion is eligible for one continuing education credit from the Medical Library Association. We'll drop the link to the evaluation form at the end of the discussion. So this panel will explore the realities of virtual library services in a hospital environment. I will ask the panelists 3 questions, and then we will open it up later for your questions. So just a little bit of background. In March 2018, our region hosted an in-person event actually called Going Virtual for Hospital Librarians. And during that in-person event in 2018, we discussed the feasibility of creating virtual libraries and what the concerns were of librarians. Since that time, we had a pandemic, which sent many, but certainly not all, librarians toward remote work. And virtual libraries were happening whether we were ready or not. Amanda Scull, who is formerly of the Dartmouth Biomedical Libraries, edited a book entitled Virtual Services in Health Sciences Libraries, a handbook, and the book was published in 2022. I will send a link to information about that when I send out the recording. It is an excellent snapshot of the transition from on-site services to virtual services. So I encourage you to check it out. But today is our opportunity to find out what is happening now. So our panelists are Jill Dabby, Regional Medical Library at Champlain Valley Physicians Hospital in Plattsburgh, New York. Karen Goodman, Director of Library Services at New Hampshire Hospital in Concord, New Hampshire. Jonathan Ratliff, a Library Service Program Manager at Samaritan Health Services in multiple locations in Oregon, and Elena Vitale, Research and Education Librarian at Dartmouth College, Medical and Health Sciences Libraries in Hanover, New Hampshire. So let's get started. I'm going to start by asking everybody what your virtual is. So maybe Jill, you could tell us what your virtual is.
Thank you, Margot. So I began working on site as a solo librarian full-time at CVPH in January of 2018, and I've served providers and staff at this facility and its surrounding community. While I was situated in a physical library with print collections, the majority of the requests came via email or telephone and not from in-person transactions. During my interview process, I discovered the library did not have a web presence or an OPAC, so my first order of business was to create a public-facing website so I can make library resources accessible to staff wherever they were. I posted links to CINAHL, Nursing Reference Center Plus, nursing ebooks, and PubMed, and eventually our first OPAC, as well as a variety of reputable consumer health resources. Being new to my position, I monitored library usage that first year and noticed that while the space was well utilized, the physical collections were not. After reviewing the last 5 years of document delivery stats, I made significant changes with the 2019 journal renewal. I moved well-used journals to online only and eliminated print. I also worked with our IT folks to implement easy proxy authentication for remote access and set up PubMed link-out services using the EBSCO full-text binder to streamline self-service to our newly online resources. As I announced these changes to our facility, Shared Administration asked if I could extend journal access to the 2 New York partners in our health system who were also without library services. Shortly thereafter, I was able to secure annual grant funding from our local library council to offset the cost of these multi-site licenses. I also offered article delivery and literature search services to both sites. At this point, I began fielding requests from all three hospitals, which came in handy when COVID struck. In summer of 2022, an opportunity to be closer to out-of-state family presented itself, and after discussion with my leadership, I moved to Florida that November and was fortunate to be able to bring my job with me. I continued to deliver virtual services and resources via the library website. Statistics were showing more than 50,000 hits over a 5-year period. In fall of 2023, the health system announced plans to merge all 6 of our hospital websites into a single shared website. Being the only library in the system, and because my resources were primarily for staff and not the public, it was decided that the library's website would not be included on the new public site. So, to ensure uninterrupted access to resources, I developed a new medical library SharePoint site and moved all the library resources and services here so all 3 hospitals could access them. During that time, I was also made aware that the 2 Vermont community hospitals in our system lost access to contract library services through their local university. I immediately reached out to both sites to offer document delivery and literature search support. The library's public website finally disappeared this past fall when the Health Network launched that new consolidated site. Even in its absence, I still have a handful of community physicians who reach out by email for information delivery. So to answer Margot's question, my virtual is providing efficient access to information services and resources at 5 community hospitals from over 1,400 miles away. On average, I respond to 130 literature search and 500 article requests annually. The SharePoint site is going strong with more than 5,000 visits from nearly 800 unique visitors since it started. Using Teams, I respond to reference requests and deliver orientations and training sessions throughout the year. I'd say so far it's going pretty well, and I'm actually enjoying the experience. Thank you.
That's great. Thanks, Jill. And Karen, what is your virtual? Karen, you're still muted.
Go.
There we go.
Okay. Thanks, Margot. All right. So my virtual is I'm in a state hospital library, and I am a part-time solo librarian, no staff. So I am, it's a psychiatric hospital, so we do a lot of research here. And other than having a small reference section that basically serves as a sort of like disaster planning, I have, just certain ones that are available in hard copy. All of our resources are electronic. I no longer have print materials. I had a very nice physical library, and then I was given 2 months' notice to go virtual. And let me tell you, that was a scary situation to try to do that. But I do have an office that is co-located with our interprofessional education center that's located in the professional development wing of the hospital. So at least I wanted to still have presence so that people wouldn't forget that they have a library. I walk around and people know me. I've been doing this for, about 13 years. So anyway, drop-ins are welcome, but much of my library business, of course, is done via email or phone. There's always the need to stay visible. Like I said, I have more of a hybrid work situation, in-person library and orientations. I insist on that. Every new person, every new medical student, every resident I will meet with and show them where they can find all of our resources. I had to build a website just like Jill had talked about. I had to build that presence and the OPAC and everything and put it out there. I am fortunate to be afforded the opportunity for a good work-life balance, though that wasn't always the case, so that I can, if it's really bad snowstorm or anything like that, I can work from home. And let's see. Oh, when I mentioned that I had very little time to convert from physical library, everybody was always looking at space. and I would see the space committee walking around looking at my area. So it was like I knew it was coming, but you just think you had more time in which to do this, to convert, and that wasn't the case. But I reached out to the MedLib listserv for any tips from any librarians that had gone virtual, and I really got some good tips from folks. And that book that Margot mentioned, I also got that and read her that. And so I've been right online doing those kinds of things. Let's see. So I had already converted most of my journals to online subscriptions, had to get rid of the print journal archives. I offered them to NLM, and what wasn't taken were sent to our state auction house because, again, it's bought with state funds. So therefore, they have to handle it. I can't just give it away. But I did offer it to the departments along with any DVDs or anything like that. And everything else, again, went to the auction house. So here I am. That's my story.
Great. Great. Thanks, Karen. And Jonathan, what is your virtual?
Hello. Virtual really describes about every element of library services at Samaritan. Even though I'm technically a hybrid employee, as Margot mentioned, the health system at Samaritan is spread across three counties in the central Willamette Valley in Oregon. We have five hospitals. We have more than a dozen clinics. We have people working remotely in lots of different parts of the country. And so virtual library services really are a necessity in that environment. I'm also moving to Portland out of the Samaritan service region this weekend. So I'm going to become more virtual than I was previously. But at Samaritan, I manage an all digital collection of ebooks, electronic journals, and I provide our reference services mainly over email. And as some of the others have said, our physical library, which used to be a thing in two of our hospitals, has slowly sort of atrophied. We've reduced those print holdings. They didn't purchase print books for the library starting in about 2015 is when book purchasing ended. Our final print subscriptions for journals were canceled around the start of the COVID pandemic in 2020. And then in 2024, our library space, the main library space at Good Sam Hospital here in Corvallis, was renovated, and that eliminated our sort of vestigial print collections. So it's all 100% electronic now. And as a result, like Jill, I have had to spend a lot of time improving our web presence and our discovery services. So that's been really crucial to help keeping things organized in that sort of abstract kind of digital resource space. So I work a lot on our link resolver integrations with PubMed, with Outside Tool and PubMed, with UpToDate, with a big list of publishers. Actually, I find that almost all of the publishers have some option to put your link resolver in there so that you can, when your users are on those resources, they can get connected directly to the library. And I think that's really helpful for them to see that there's a link they can go and find that resource at the library. So I try to promote those tools to help people navigate all those resources as seamlessly as possible. I'm lucky to really enjoy working with that kind of stuff, so I feel like I'm in a good position to work on it. I talk about it a lot in other presentations. I do still present some talks about library services in person when I'm invited because I live in the region, so I'm able to do that. But increasingly, those in-person seminars and talks are being scheduled online. And so there are always more opportunities for virtual engagement with our library team.
Great. And Elena.
Hi, this is such an amazing turnout. Just have to pause and say that. My name is Elena Vitale. I'm a research librarian at Dartmouth College. So my situation is somewhat more complex because I work for the college, but we're licensed to support our clinicians at Dartmouth Health, Dartmouth Hitchcock Medical Center, which is located in Lebanon, New Hampshire. Dartmouth Health itself is a large rural healthcare system. It spans New Hampshire and Vermont, so it has been slowly acquiring a number of the smaller healthcare systems across those two states. So further complexity that we have a campus library. We're part of a larger campus library system that's largely undergraduate focused. And then we ourselves have a site at the hospital where I'm reporting from today. So our services are really very much hybrid. My virtual is very, very hybrid. Um, I do a lot of Zoom. I would say that Zoom is my second home. Um, I tried to think about the ways that we support our researchers and what is the most hybrid and what is the most in-person slash virtual. And I broke it down into a couple of buckets. And research support is, of course, the bread and butter of the work that all of us do. And for the most part, that work has really been hybrid, supporting our clinicians. They're coming to us from across those two states, and we're working with them via Zoom to get their research squared away. The other thing that is, of course, I imagine a theme for all of us here is licensing. So working on licensing arrangements across these different entities who have different access. I tried to count up who has what, and of our system, 9 sites have up-to-date Incenol, 2 have up-to-date Incenol, but don't have, so 2 don't have Dynamed. It's very complicated, even for me, and I work here, and I think I need a little post-it note that I just look at all day long that helps me understand, because it's very, very complex. Our teaching is really quite hybrid these days, so we are, of course, happy to come in and teach, but a lot of the times we are teaching on Zoom. And then our collections are also a mix. So we're still purchasing print books. We have a modest print clinical collection here, as well as a print consumer health collection. And then our journals are largely online, electronic. We are probably we are definitely a larger staff than my other panelists. We are a staff of 14. So I think we are certainly a little bit more resourced in that regard as well. So my virtual is hybrid. Margot, you're muted.
Thank you. Before we move on to the next question, I'm going to launch a poll of where people are at. If, so we have Jill, who lives in Florida and is working in upstate New York, and Karen, who has an office, but nearly everything that she offers is virtual. Okay, just give this a little more time. All right, I'm gonna give it a couple more seconds before I close it out. Okay, I'm going to end the poll and share the results. So it looks like we do have almost a quarter of you are not virtual. So I'm glad you're here to check it out. Then the largest percentage are like Elena's. So that's very interesting. So, all right, I'll stop sharing that and we will go on to our next question. All right. So the next question is related to professional development, staff morale, even if you're like the staff of one, keeping your morale up. And so we'll go around, and this time we'll start with Karen. How do you keep up with your professional development and or your morale?
Okay, so if you enjoy being part of a team, be ready to go it alone. But if you can try to carve out opportunities for yourself to stay engaged with your patrons, find every opportunity to do so. I know I like being part of a team, and I certainly can work alone, but it's lonely sometimes, you know? So anyone in this position must be self-motivated, a lifelong learner, and willing to advocate for yourself. And also try to find people who will advocate for you. And you need to be proactive in that. Sign up for any medical librarian associations, listservs that can help keep you updated on current trends, because you don't have anybody in the hospital to talk to, unless you reach out to, your listservs. search out as many online training programs as possible. Now, in my situation, the state does not pay for um, part-timers to have training opportunities. So as many free opportunities as I can find, or through scholarships, like through the North Atlantic Health Sciences Librarians, or MLA, those opportunities I try to take as much as possible. And I get on committees here so that people see me and they know that they have a library. Um, so, I was under rehab department for the longest time, and now I report directly to the executive leadership team. So that helps in that regard, so that I'm on the hospital management committee. So again, I can highlight some of the things that I'm doing, some of the new things, and get the word out there. And I try to reach out to the departments to set up any kind of an assessment opportunity. But it is tough, and you need to advocate for yourself. I guess that's about the strongest thing I can say.
Yeah. Okay, Jonathan, professional development, morale.
So I think that being a solo librarian, like Karen, managing mostly virtual library resources does have some unique challenges. Like a lot of us can relate to, I don't have a librarian as a supervisor, so I have to take some extra time to advocate for my professional development needs, sometimes to explain sort of the purpose and the benefits of different conferences or different activities, to make sure to communicate how different professional development is valuable to the library and also to the organization at large. So my supervisor has always been really supportive of all of my professional development goals, so I'm really fortunate in that respect. But there is a little extra legwork involved in making the case for things that I think might be either seem a little more obvious or taken for granted in different kinds of institutions where you have more of a supervising librarian structure. So um, I think that being a virtual librarian, especially a librarian who doesn't have other library staff at their institution, can be a little isolating. So I really value opportunities to connect with my colleagues in the region. I think some of them have joined our call because I'm a member of the Pacific Northwest Chapter MLA, and I'm at their meetings every week. And I really cherish those opportunities to connect with colleagues outside of the institution and to get involved in organizations. So I really recommend, even if you're not a solo librarian, of course, I think it's really valuable. But um, our chapter organizes meetups in our region. I'm really excited to be moving to Portland because I have some more colleagues there who we have a really good time hanging out. And I think that has been a really great sort of outlet for some of the kind of library stress that I don't really get to communicate with other people. So that's the thing that's really specific to my role as a solo librarian, is seeking out and taking advantage of all the opportunities that I can to connect professionally with other librarians.
That's great. Thanks. And Elena.
Yeah, I think I'm not, of course, I'm not solo. I'm part of a pretty large team. Um, And so I don't think we suffer here for lack of camaraderie or feel isolated at all. We have a very strong team who's also very social with one another. I think my biggest challenge here, as far as patron facing aspects, is that we don't have a great hybrid setup here for teaching classes or for holding large, let's say, hybrid orientations, something like that. We have a classroom here that's very, very small that has terrible technology. If you want to teach in a hybrid fashion, you can set up a laptop and flip it around and look at some people on the screen and some people in the room. And that really is not a very effective way to reach anyone there, which is a shame because I quite like juggling the hybrid situation. I really wish we had better technology for that. I would say too, another challenge as far as patron facing for us is that, someone alluded to this in the chat, the multiple licensing is really, really complex. And that can be complicated and I think detrimental sometimes to the relationships that we're trying to build with patrons at other sites. So some people have access to some things and some people have access to other things. And it doesn't make sense to me that a clinician who practices at one site should have lesser access to resources just because they happen to be based at a different site that doesn't have the more powerful subscription. And that can be upsetting to me as a librarian. I want everyone to have equal access to everything for the good of the patients in that area. So I think that multi-site licensing is really complicated and definitely a challenge. And I'm really grateful that we have the support of a large centralized campus library who are really good at managing negotiations and easy proxy and things like that. Because without that, I think it would be that much more difficult. And to answer that question about who pays for what, the med school pays for some things. Some of our budget is centralized, so the main library is chipping in for some things, and then the nursing department is paying for some other things. So it's very complicated.
I will say I've been to the Dartmouth Library and I can believe the technology isn't that great, but the building itself, there's some gorgeous parts of the building that are very old and very beautiful. But anyway, Jill.
So for me, the greatest challenge when working remotely is staying connected. I'm an extrovert by nature, and I've always enjoyed heading to the hospital cafeteria for coffee or lunch and greeting people in the hallway, which often led to information requests or an invite to participate in a project. I felt very isolated after moving, especially because I also gave up my car. It didn't make sense to make a payment if I wasn't commuting. So I took up walking 2 miles every morning before work and have made several connections in my neighborhood. So this helps quite a bit to make up for the lack of worksite interaction. Fortunately, in my colleagues, I have several library champions who always promote the hospital library in their work, and this often leads to meeting invites and new connections for me to support projects. Um, Regarding professional development, I haven't found this as much of a challenge while working remotely. I've never attended an MLA conference in person, but I've attended several virtually now and presented two posters. Since moving, I'm also now a member of two regional MLA chapters, both Nozzle and Fishla, and I've attended several virtual meetings and events for both. Working virtually has opened doors for me. There are so many virtual offerings available through an NLM and MLA, and many of these are low to no cost or can be funded with scholarships and grants. So since being remote, I've renewed my consumer health information specialization and completed the RTI Institute through MLA. And I recently began pursuing the systematic review service specialization as well. Outside of MLA, opportunities like the Institute for Healthcare Advancement's Health Literacy Specialist Certificate was something that I was able to pursue online with funding. So there's ample of opportunities if you are willing to go out and find them and find things that are a good match for your interests as well. I'm always looking for one-shot offerings to keep up on new trends and have found several that have been very informative and enjoyable, like the scholarly snippets held by California Health Sciences University. I really found that with effort on my part, I can stay connected, both with professional development and keep up my own morale. So.
That's great. Those are a lot of great ideas. And if there are things that the audience has done, you could throw that in the chat. We'll get back to that after the next question. We have one more. So when I thought about virtual services, I thought one of the biggest challenges must be marketing, because if you're not walking down the hall, that sort of thing, or being in the cafeteria. So this is the question is like, how has this influenced how you market and promote library services? And we will start with Jonathan.
So as a few of us have mentioned so far, because of particularly, I think after COVID, a lot of committees in our institutions went virtual anyway. And in our institution, because we're spread across a big area, most of those committees are meeting on Teams. It's actually been really easy to get involved in committee work and join different groups just to get my face out there, get my name out there, make sure that people are aware that a library services program manager is a person who they have access to as a resource, and also that the library has resources. So awareness can be a big problem in any library, but particularly when you don't really have that physical center that advertises your existence, I think it's really important to get involved with committees that seem relevant to, or interested in research, quality improvement, um, evidence-based practice, all those sorts of things are committees at any hospital library, and you can find out who to contact to get yourself involved in that. Depending on the level of work you want to get involved in. That's, what your capacity is. But I also think it's been important for me to build a relationship with our marketing department to help make things like flyers and posters that promote services or just promote the library as a thing. Because I'm not at all of the different sites to put things like that up. It's been really helpful to reach out to people like our marketing folks or nurse leadership or medical staff leadership to find out where the good places to put information about the library even are. And you won't really learn those things unless you're engaging with people who are working directly with those staff. So since I do work a hybrid schedule, I'm able to come in and put some things up and talk to folks and make sure the spaces have accurate and current information about library services available. But it can take a little bit more coordination for remote librarians to manage that. So I think reaching out to those people is maybe a good first step. And the posters that I have up, like in the library space at our largest hospital here in Corvallis, where I actually have an office, um, uh, have QR codes on it, and I brought a visual aid. So there are QR codes here that you can scan to send a Teams message directly to me, and then also to go to our library webpage where you find our discovery layer and everything. And then I also have been putting on the back, you can't really see them, but there are these NFC tags. You can actually just tap your phone on these now. You don't have to scan them with the camera. So it's a little easier to do that. So you can buy these in a pack of 50 on Amazon for $15. You program them with your phone. It's really cool and futuristic. So it feels really high tech, and I think people find it interesting. So following from that, I think having a really good online presence is key. I mentioned this earlier, but we use SharePoint for our intranet, and I've had our web team put links for library services in a few prominent places online. In our clinicians portal at the very bottom of the homepage that everybody sees as soon as they open the web browser. And so the libraries information about how to access the library is available really easily for people to just click on and go to really quickly. I work really hard on that website because that's the entry point for library services and kind of the first and last place that they go for library information. For most of the people in our organization, they're not coming to the library. They may not be reaching out to me directly to learn things. So I try to put everything that I can on the webpage, organize it really well and make it look attractive and active, like it's a resource that is, being tended to and cared for on a daily basis. And I think that helps a lot with just making people feel confident that library services are there and are robust enough to help them. So that's been really helpful for me. Working on integrations with Discovery Search, with our A to Z lists, with our database lists, integrating library search into PubMed and all those other things. I think really help to kind of flesh out the library experience, even though it is all virtual.
Great, great. And Elena.
Yeah, my biggest piece of advice here is I'm gonna copy right off of Jonathan is make friends with the people at your hospital who do marketing. Meeting the person who does marketing for the nursing department has without exaggeration changed my life. She is an email away and she can push things out immediately and people know her name and they like her and they listen to her. So getting to know the people who do the marketing for the units that you're trying to reach can be incredibly helpful and can be an incredible efficiency so that you're not spinning your wheels. Creating great programming that no one knows about. I've also I would recommend everyone be working with their continuing medical education department. See if you can get CE for the workshops that you're teaching, continuing education credits. There's specific credits for nursing, for clinicians, for pharmacists, for social workers. And if you're able to get those credits for your PubMed workshop or your Zotero workshop, that's a great population that you'll be able to reach without any effort at all. And they'll be really excited to take your workshop because they get a little bit of continuing education credit there. In our library itself, we've formed a marketing committee. So there's an internal committee of about 3 or 4 people who brainstorm different ways that they can reach out to all of the different people that we work with. Some of those are physical, so coming up with cute little brochures on Canva that we sprinkle around the library, or some are ways that they can be more strategic about pushing out our digital marketing. Um, Last year, I had strangely good success with a workshop that I called Wait, I Have a Library. I taught it once, and then like 4 or 5 different units wanted me to teach this workshop for them because they actually didn't know they had a library. So taking my workshop on the road, Wait, I Have a Library was actually really useful. And I just talked about ways that working with the library can help make your research efficient and a little bit less painful for you at that point of need. I did a lot of legwork too to identify when I started here to identify partners who I thought would be good candidates for workshops like that. And establishing that relationship, which takes a couple of years, has been a great way for me to push the word out about our workshops. So I encourage you all to steal my workshop idea. Wait, I have a library. It's been really fun.
And Jill, I know from the get-go you've been spreading the word about your library. Could you talk more about that?
Sure. So marketing and promotion of library services has always been challenging, and obviously we've all had our own experiences with that. Even when we were on site, you have those folks who say, "I didn't even know we had a library," like Elena says. So it certainly is a chore, and it's not a one and done kind of thing. Passing folks in the hallway was always helpful, but now that I'm off site, I had to find other ways to connect. So over the last 8 years, I've spent a great deal of time developing and adjusting the library's online presence, like Jonathan mentioned. I've also created print and online flyers and newsletters, recorded education video sessions for new orientations, and delivered one-on-one tailored sessions for family medicine and nurse residents. As I've added new hospitals under the library umbrella, making connections with these new providers and staff has been challenging, mainly because I'm not there and I don't have permissions to send group emails to certain audiences, especially at the new sites. So this is always going to be a work in progress. I can say word of mouth has absolutely been the most effective way for me to generate new business. One happy customer tells another, and this has really been a significant source of the library's growth. As mentioned earlier, I also have a few on-site library champions who always mention the library as a resource to consult. I'm very grateful for them. Based on my experiences, I'll share just a few thoughts. Information delivery is my priority over anything else. It's why I have a job. Therefore, I deliver requested articles and literature searches same or next day. The feedback I get about turnaround times shows how much they appreciate this, and they tell their colleagues. So this definitely has helped the service to grow across all 5 hospitals. As Jonathan mentioned, having the highly visible web or intranet presence that features all your resources and services in a very organized and appealing and attractive way is crucial. I share this URL everywhere. It's on flyers, newsletters, and even in my email signature. Connecting with new hires, as Karen had mentioned previously, customizing flyers and making sure that specific resources are listed specifically for them and their profession. And connecting with HR or med staff can help you to get notified when new staff or providers come on board so that you don't miss anybody. Sorry, it's dark. If you have nursing or physician residency programs, team up with leadership to offer meet and greets to provide orientations to relevant library resources. I have 30 to 45 minutes with this group every year, and I demo PubMed link out as well as UpToDate and Clinical Key and help them set up their personal accounts so they can start earning their CME right away. And they've quickly become regular patrons of the library because we've made that initial connection, I believe. Also, as Jonathan mentioned, implementing that PubMed link out tool for seamless connection to your library subscriptions has also been a very significant part of why business has picked up and why it's been successful. When full text isn't available, that link out tool provides for a document delivery request form that auto-populates with the citation, and then they just enter their name and contact information and click a button, and then you get a request. It can't get any easier for them. They don't have to copy and paste a citation, start an email, remember when they get called away to come back to it later. It's right there, one click, and they're done. And you can put it in other places. It doesn't have to just be in PubMed. So I have our full text finder implemented in CINAHL, Health Business Elite, as well as in PubMed. and I get requests from all of them. One thing that I'm not a big fan of meetings personally, and especially not meetings about meetings, but I do recommend that you attend any meeting you get invited to, and ask to attend the ones that you're not invited to that you'd like to be a part of. While they might not always be aligned with your work or your interests, showing that the library is there to support the work and that you're interested in what's taking place, especially around patient care. It's a great way to get involved and to make connections and maybe reach somebody else that didn't even know there was a library. Lastly, showing gratitude. I always start or finish my email response with thank you for using the medical library. I want them to know that I value them as a patron, as a customer, and I hope that they are happy with my services and that they will come back again, and to know that they are welcome and invited to please come back and use the services all the time. So those have been my experiences. It seems to work well, and I just really feel very connected to the folks because of those different things.
That's great. And Karen, especially as a part-timer, how do you do it?
Well, many of the things that everybody has already said, I'm doing, but let me just say that you need to be as proactive as possible. The need to stay relevant and promoting yourself and what you can offer is critical to the long-term success of the library. Setting up annual needs assessments with the departments is a good way to, again, get your face out there, as well as getting people to realize that, yeah, we got a library and they have some great resources. As much as possible, get on key committees. And so, like, I'm on best practices, I'm on the EHR committee. I really asked to get on that committee because I was overlooked on that. And I thought I definitely needed to be on that. Hospital management committee, grand rounds, planning committee. Um, Again, so that your face is out there and people see you. Advertise any new resources that you have, either through newsletters, email blasts, or in my case, I have set up a news area on my webpage. Create a strong intranet presence. For instance, I have modified my EDS with a cover page that allows for quick access to key websites and to my ebooks. I advertise those like on a carousel, and especially Joint Commission books and things like that, where all the departments need to get to something quickly. It's there. They can see it, click on it, and they've got it. Establishing yourself as the copyright go-to person. You know, again, people don't always think about asking for permissions for the use of things. And yeah, I'm right out there and I constantly harp on that. So they know to come to me on that. Advertise and provide training on resources, includes also AI. So I've been learning a lot about AI and some of the better ones to use for medical research. Provide in-person library orientations on a regular basis. And then work with the executive branch administration to schedule these sessions. And that's been going very well. So it's only 15 minutes, but I get to meet everybody that comes in. Overarching issue for me is budget constraints in a state hospital. So again, I have to advocate very strongly for what we need and what I think the hospital would benefit from. Working on that, trying to get up to date, and Lexidrug, so that everybody is working off of the same page and not our providers from Dartmouth, for instance, using up to date and the rest of the hospital not using it. So anyway, and one more thing, I wanted to highly recommend reading an article, and I'll put that in the chat, but it was by Jerry Carlson. He did this in 2017 called Virtualizing a Solo Library. It was in the Journal of Hospital Librarianship. I'll put that citation in the chat for you. It was very helpful to me going virtual. That's it.
Great. That's great. And we are like on perfect time for what I had sketched out. So now we have time for questions. I'm going to take a look at the chat. I'm going to open that up and scroll
So Margot,
all Yeah, go ahead.
I was just going to say there's been a very active chat, so it might take you
Okay.
a second to look through, but and there have been a lot of answers from our panelists, so thank you so much for taking care of those. There's one question that hasn't received a response, although it might have been covered in people's what they were sharing, but with the increase in telehealth, do you see more hospitals
Mm.
requesting virtual access, or is there still a demand for a physical library within a hospital? And then I think secondary to that is what computer skill does one need to learn to start or maintain a virtual library?
Can I speak to that really briefly?
Yeah.
I want to say, if you're in a position to advocate for retaining some kind of space for using library resources, even if they are completely digital, please do that. It's really important. Our library space no longer has books and journals in it, but people are in there every day on the computers. They're doing research in our with our resources, and they're really using that space. It's unstructured. It doesn't need to be scheduled like our computer lab. It doesn't feel like a computer CBL classroom. It feels like a library still, and I think that that's really valuable for people. So even if it's just a small space with a few computers in it that people are using for library resources, I think that's valuable, and it's still in demand, at least in our institution.
Mhm. Anybody else have thoughts on telehealth and its impact? Right, I'm scrolling through. Is there anything else, Benny, that you had
I was
seen?
just thinking that I don't think there's any questions that haven't had some response, but
Okay.
if any of our panelists see something they'd like to just chat about more, as opposed to,
Hmm.
um, okay, there's a question. What do you mean by multi-licensing is complicated? If
So I think this is maybe addressed to me. Multi-site licensing, as in we have, um, 11 member institutions and they each have different access to resources. So here on site at Dartmouth Hitchcock Lebanon, our users have access to every single resource that the library system subscribes to, with the exception being the New York Times. Um, Whereas our site institutions, Alice Peck Day, right down the road from us, has access just to 3 or 4 of the resources that we subscribe to. So the multi-site, um, who gets what and why that is complicated, I think, for us.
Margot, I can chime in on that as well.
Hmm.
When I started at our library, it was just the single site. And so anything that was subscribed to was strictly for our location. When I was able to add on to the other 2 New York sites, I was able to get the grant funding to help cover the costs because the multi-site licenses are a lot more expensive and they require some negotiation and setup because of the different IP addresses and who is allowed to have access to what. We are also affiliated with the University of Vermont Health Network, and that adds a layer in there, much like what Elena is talking about, where you have a large academic university medical center that is supported by the neighboring university library. And the resources at that university library are not available to our other 5
Right.
sites, but they do provide for the medical center. And we get a lot of pushback from especially newer providers. Well, why can't I use the Dana Library resources? Because they're not licensed and it would cost a lot more money. And my budget is separate from theirs. We're still working on someday maybe consolidating and having a network medical library. So my budget pays for things that I deliver, maintain, control, negotiate for, and then they take care of the university and the medical center. So there's a lot of moving parts, especially then when you add in the fact that we have 6 sites. Elena, I think you mentioned you had 11 different sites. Setting up IPs, and of course, IP addresses can change. Things like security layers, like Zscaler, get thrown in there, and that can put a crimp in access, troubleshooting, and then easy proxy. It can get very complicated. It can be done. I'm doing it. Elena's doing it. Jonathan, we're all doing it. It just takes knowledge, patience, and money because the multi-site licenses are very expensive.
Mm.
And then you add a new site and the excitement starts again. So it feels like a kind of never-ending discussion here in a lot of ways.
I can speak to John's question if somebody else doesn't have or would like to go. It's John, for me, metrics, I am constantly monitoring usage of the resources. The majority of my licenses that I pay for out of my budget are for my location at CVPH only. And then I have a handful of licenses, like now we have Dynamic Health that replaced Nursing Reference Center Plus. So I have about 5 or 6 licenses that apply to all 3 New York hospitals. And then we have network resources like UpToDate, Clinical Key, and some other things that all generate their own usage statistics. So I have about 30 different tabs on my spreadsheet where I keep track of my monthly stats because my budget is limited like anybody else's. It doesn't end, wherever I say it does. I have a cap and I can't go over that. So when something goes up 5 or 10%, I have to find a way to make up for that. So making sure that the resources that I have are effectively and efficiently meeting the needs of my patrons is of utmost importance. When I first started at the hospital, I took a look at the DocLine stats for the last 5 years and found that we were requesting a lot more than we should have been, and I'll leave it at that. And I've made a lot of adjustments in our subscriptions to better meet the demands, but also to make sure I was aligning with copyright regulations, the rule of 5. So knowing that you're meeting those needs and you're not having to go out so much to get things from other institutions or paying for things elsewhere, I think that is a measure of impact and success with a virtual library service. Repeat customers, you have your own ways of measuring your traffic. I can count reference stats like they do in an in-person library. So I think there's a lot of different ways you can measure that. It depends on what your administration wants to see from you. I also look at cost per use and use that to determine whether or not something gets renewed. So good question though. Thank you.
Mhm.
This is Benny again. I don't know if this is something folks might have more questions about. I know it sounds like different people have had different levels of success working with IT to have control over their websites. I don't know if that's something else anyone could comment on or any ideas.
I did answer that a little bit, but I'll address it a little bit more. Because all of our intranet sites are on SharePoint, the team that manages the SharePoint instance all over the system generally lets different groups handle their own sites however they want. I think that works out pretty well because SharePoint is relatively limited in what you can do with a site. You can create pages and you can add content to it that's plain text and you can embed a very limited set of things and I've had to ask permission to embed other things like our discovery layer search box and so because it's so locked down, I think that our IT team is pretty cavalier with what they let you do on there because they know that you can only you can only cause so much damage to the infrastructure with a SharePoint site. So but things like I mentioned, if we were to ask them to allow us to purchase a LibGuides license and link directly to that, they would want a little bit more involvement there because it's an external site and it has all of its own security considerations that and especially if they wanted to integrate with our Active Directory so that people could log into the site and other things like that, it would be a little bit more complicated. So I think that what I would reiterate is just that developing those relationships is really key with IT folks, just so that they know that there's a person here and you have really, the interests of the organization are front of mind for you and you really want to do things that are useful for your users, but you need their help. I think that most of the time they're willing to kind of work within whatever restraints they have in order to help you. But that's been my experience. I know that people have less sort of positive stories about their IT department interactions, but it's been a relatively positive relationship in my institution so far.
It definitely took time to build. I too now have a really strong relationship with our IT folks, like Jonathan mentions, where you can get things done, you can get their help with things, you can have help with troubleshooting. It didn't start out that way. My predecessor didn't have much technological, um, I don't know what the word is that I want to say, but there wasn't much technology going on in the library. Most things were print, and they didn't need to be involved. So other than maintaining the computers and making sure they had their security updates, IT wasn't involved in the library at all. When I first reached out and asked them, can I have this? Can I make that? Can I do one of those? I got a lot of pushback because it was new work for them and they're strapped too. And I had to keep that in mind that I have all these big, beautiful ideas and they still have the same work that they've always had. And now I'm asking for more. So it took time, it took patience, took a lot of being really nice. A couple of times I had to go around certain folks to get a little bit higher up the ladder to explain what I was trying to accomplish and why it would benefit the organization. And if you can do that, they're much more likely to listen. And if they don't have to pay for it out of the IT budget, they're also much more likely to listen.
I want to throw something in about IT. Again, sometimes it is a tough relationship, but you do need them. And trying to convince them that you want to be a strong team player, um, you know, sometimes falls on deaf ears, but you got to keep trying. And I found that, especially in trying to bring in Open Athens, some remote access, everybody wants to say, no, no, no remote access. They're throwing up all firewalls all over the place. But I think eventually I finally got through and was able to do this, although I can't have single sign on at this point, but I'm keeping on working on it. But yes, it is important to have a good relationship with IT. It's sometimes hard to do.
Mhm. Well, thanks everyone for joining. Benny, if you want to drop the evaluation form link in the chat, that would be great. We do ask, even if you're not looking for credits, if you could fill out the evaluation form, it's really helpful to us, helps us get ideas about what to do next and how much this served the needs that are already out there. I also want to say I've jotted a few notes down, and it seems like we're talking a lot about relationship building, whether that's with your marketing people or your IT people. And a lot of times with librarianship, I think we need to play the long game too. We need to make sure this is like totally in a different direction, but we need to be supporting libraries and public libraries, school libraries, because the people who support libraries are library lovers and they started their love relationship when they were kids. That's been my experience anyway. So support libraries of all types is is my big takeaway here. So yeah, so I think did did the link get dropped? And yeah, okay. And yeah, and I see there's been a lot of communication in the chat, which is great. I will be sending out the recording. I grabbed the citation that Karen had shared. So I'll send the link to that and to the book that I talked about that Amanda Scull had edited a couple of years ago, which is now it seems historical, because so much has changed. But it had some really great way to think through what the changes were when and during the pandemic and how to come out of that. So and and I think that's it. So thank you everybody for attending today's session, and we will be in touch soon. I will stop the recording.